Falls can happen at any age. However, as we get older, falls become more dangerous. Seniors are more likely to face serious injury, hospitalization, or even admission to long-term care facilities as a result of falling. The good news is that, at any age, we can take steps to improve our health and reduce our risk of falling. Why is falls prevention important? Each year, 1/4 to 1/3 of all seniors experience at least one fall.
Fall calls are very prevalent, I would say. We know that falls can be dangerous for any age group. We could have at least 3 a week, if not 1 a day, if not 2 for the same person in 1 day.
Falls prevention, holistic health. Maintaining a healthy lifestyle is important to our well-being. Eating balanced, nutritious foods and staying active helps us stay strong, focused, flexible, and able to carry out everyday tasks. It plays a role in preventing illness, reducing symptoms related to chronic health problems, improving our mood, reducing stress, and it also helps to reduce the risk of falling.
Try and be sensible about the things that you choose to do and when you choose to do them. So you really need to be cognizant, you need to be aware of yourself and your own abilities. You want to try and keep your movements and your strength up as much as you can, especially as you age. It's really important. It's certainly going to help your well-being.
I have weights that I hang on to every day, and I walk back and forth the living room here going like this because I have to have the strength in my arms to get through the day some days. I do it at least 3 times a week, and then I have a rubber ball that when I'm sitting at watching TV, I hang on to and put up above my head. It's all a total body thing when you get to my age. You have to always be prepared for falling, I guess. You have to watch out for it all the time.
Medication management. Seniors can reduce the risk of falling by understanding more about their medications and the potential side effects. Talk to your pharmacist to better understand your prescriptions or if you are experiencing adverse reactions. What to do after a fall.
It's hard to ask anybody to assess a patient or decide whether it's an emergency situation or not. If at all you ever have doubt, call 911. It's better that we come and assess the patient and rule out anything than to have something major happen and think, well, it doesn't really look that bad. You know, there's some things that you aren't able to identify on the outside just as a bystander or even as a paramedic. So always err on the side of caution.
Falling fears. There's lots of evidence that once someone has had a fall, it has impacts physically, but it also has huge impacts psychologically as well. It's just that fear of falling again. That can really impact, whether that person leaves their home again, whether they, attend community functions like they used to, whether they even attend family functions like they used to. So they're isolating themselves, but then they're also getting isolated from their family, friends, community.
A few years ago, I did fall. I tripped on a chair leg. It was scary. I'd never fallen before. Ever since then, I was always on the lookout for all these little things on the street. I had to walk where the street was clean. You watch every step where you're stepping. Even just getting out of the car, you have to make sure there's nothing there that's going to twist your ankle, or I think it's one of the hazards that being 77, you think about all the time.
Once they have had a fall, there's lots of opportunity to connect to all the community programs. One, for example, our falls prevention program, that's important, especially for our elders or our adults, and even the kids who are isolated, to be able to kind of reconnect to the community. There are several programs and services in the community to help overcome the effects of falling and help you return to enjoying life.